both on the side of treatment and then also what we call morbidities, and that is side effects of treatment. And we have contributed a great deal to algorithms or clinic practice guidelines at the national level. And many of those guidelines are centering around what 131 and what external beam radiation treatment can actually do to major salivary glands. And it's been a substantial challenge that happens when you have a gland or more of the major salivary glands involved in treatment. So, as you know, and know better than I, what the impact can be with having various very important structures of the upper digestive tract well within the volume of tissue radiated. And upon that introduction of radioactive iodine, life does change with regards to side effects, and we realize it. The higher the millicurie, the higher in parallel is the side effect profile for many. So, of course, we have been so eager to try to find ways that can reduce those early acute effects and then also the late effects that happen in a patient's oral cavity and upper digestive tract. And I want to introduce a little of that to you. I'm going to go past this and just say that my partners and many of those that are here at this symposium these next few days. We have a considerable number of MD Anderson's presence at your meeting, and many of us are going to be talking about side effects, and we're going to talk about its impact in quality of life. Two areas I'm going to spend a little time on is dry mouth, and the other is silidinitis, where you get these inflamed salivary gland tissue, and it can be in the major salivary glands, but it also can be in the minor salivary glands as well and impact the ability to chew and taste and swallow efficiently. We believe very strongly in what we have promoted for 30 years now, and a little longer actually in our research and in our collaboration with the American Thyroid Association of what happens with dysfunction of salivary flow the higher you go on your millicuries of 131. Again, we see substantial interference of pathways that are functioning so well before treatment that when you add the external beam element of radiation, you certainly can see diminishing effects of these glands and having a challenge that probably will be lifelong. So, of course, we're so eager to reverse, and we are so eager not to help with any type of tumor protection with the type of treatments that we give. So we have to be so cautious, don't we, with regards to that fine balance of wanting to reverse side effects, but also not protecting tumor. So we have to think about that very cautiously, particularly when we add medicines or add stimulants with regards to with our treatments for thyroid disease. We have to be so cautious there. In our earlier studies in our oral oncology from the 80s and the 90s, we looked at a huge database that we have had that have continued to be ongoing of what happens to salivary flow rates when you have had iodine 131 and what happens to the teeth and sensitivity to the teeth and what happens to the bone surrounding the teeth. And we have learned a great deal in this region. We've also learned a great deal with regards to the influence of 131 on the oral microbiome, the actual the environment of the upper airway digestive tract with regards to fungus and bacteria and viral shedding. It has an impact. What we have found in our early days, and it's certainly stood the test of time, is that there can be marked reduction in salivary function the higher the concentration of the millicuries of 131. Again, you add the radiation of external beam to that, and it is even further going to be a lifelong reduction. Now, what we do see is usually about 12 months post 131, you'll see some resurgence of salivary gland tissue. And whether it is that we're looking at what's called stimulated saliva, where you're chewing something or drinking something and you get this gustatory response, or we're looking at unstimulated saliva, which is where you're sitting, listening, and the saliva is doing what it should be doing to help cleanse the mouth and give you better pH balance in the upper aerodigestive tract. What we have found at that 12-month mark is that there is some repopulation of damage that happens from the 131 to our major salivary glands and to also soft tissues of the oral cavity. And that is a blessing. The challenge is, however, it's never to where it was at baseline. So you lose the ability to to heal in your wounds. It is a promoter for periodontal compromise and periodontal challenges. It challenges the upper aerodigestive tract. It helps to promote more dysphagia, more trouble on your swallow. It also challenges the vocal cord and with regards to vocal strength. And when you have a powerful dryness that's happening in the upper aerodigestive tract, that can be problematic for so many of us. So these first 3 to 4 studies, and I'm going to zip through this since we're moving it pretty quickly out of time. I just wanted to share with you that study after study that we've contributed to shows that with the introduction of 131 and this iodine ablation therapy, particularly for differentiated thyroid disease and also follicular disease, we find that when you look at pre versus post treatment, that xerostomia, the dryness of the oral cavity, markedly changes and it markedly increases. And it is for many lifelong. And so, again, many studies that we have looked at end up showing the anatomy of the ductal systems of the salivary glands also taking on an anatomical change. So I really wanted just to wrap up that these evidence-based approach to the topic that we're presenting today, and that is, does 131 and or external beam radiation treatment, does it impact the mouth? Does it impact your ability to have good taste acuity? Does it impact your ability to have good digestion? Does it impact bacterial loads and or fungal contamination in the mouth? The answer is yes to all of those. It impacts. And because of that impact, you can have deterioration and quality of life compromise as well. Now, we realize that there is a great sacrifice for cure. And we also realize that many of us who have head and neck cancer and are treated in such a way are also being consented to with knowledge of knowing some of the side effects that actually will occur. However, with what Dr. Aponte and I have been doing for several years is trying to reverse course and trying to build better management strategies as we go through it. So I wanted to share with you also, there is a group that we contribute a great deal. ThyCa is one, obviously, a group that we have contributed towards for many years. However, we have equal contributions to a group called ASCO. And this is the American Society for Clinical Oncology. It is really one of our sister institutions in organized medicine, where physicians come together annually and scientists come together annually to talk about the nuances of treatment and also what we are doing on not only intervention, but also in supportive care. And you'll find that there's a considerable number of us in comprehensive cancer centers that contribute to patient-related information. This is one that is quite excellent. It's a spinoff from ASCO. It's called cancer.net. And this has a great deal of discussion about nuances of treatment and novel approaches to how to treat your dry mouth. And its ravishing impact, what happens thereafter. We have found that when you diminish salivary secretions, you increase certain organisms in the digestive tract, and a great deal of what is so important to so many of us for good taste and for having the balance of being able to control bacteria that can lead to periodontal disease gets a great reduction. You see a substantial change in this very complex fluid of saliva when you have had 131 treatment and or external beam treatment or surgical removal of a salivary gland. So there's changes in proteins and enzymes and molecules, and most of us don't even think of it until we lose it. When we start to lose it, life changes. There's nothing more impacting than when you are invited to a wonderful meal and you realize that you already have deficits after a course of 131 treatment or external beam treatment, and you go to the meal and you can't have a good appreciation of taste. Your taste differentiation is markedly impacted. We call that a reduction in taste acuity. And that happens with dryness. And it also happens as byproducts of bacteria and fungus that love to live in a dry environment and also love to live in a very acidic environment. We've learned that the hard way. And we have been putting a great deal of time into how can we change the flora of the mouth and enhance better function and taste acuity and digestion for our patients. When these molecules and these electrolytes get imbalanced for salivary function, you have an increase in organisms that will eat teeth away. And no matter if you do fluoride treatments and or high potent fluoride, what we call dentifrices, which are toothpaste, prescription toothpaste, sometimes it's not even strong enough. And there are so many agents that are on the market today: potassium, chloride, amylase, stannous fluorides, sodium fluorides, other dentifrices. And many times it's still not enough to control a bacterial overload that can lead to teeth breaking, to enamel flaking, and to increase sensitivity of the teeth. So in this very short introduction, we're already very late into this presentation, but I did want to simply say to you that there's a lot to tell you about what's in the overload of the oral cavity when you start to dry the mouth. Now, when we have done these therapies to save a life, we also now are managing pain, and we're also managing allergies, and we're also managing heart disease for so many patients. And so we are taking medicines that are helping to regulate each of those areas. And guess what? It contributes also to dryness. So we call many of those agents stomatotoxic therapy, and it causes also an influence to the microbiome. So a happy medium to that is to start to regulate all of these challenges by enhancing the oral cavity by way of increasing moisture. Moisture, we have found over the many years, can greatly enhance your overall ability to fight bacteria. One of the greatest products that one can actually use to help in just that manner is the tonicity of black tea. We have studied a great deal of green tea versus black tea versus chamomile tea. And it's very intriguing to see what black tea will actually do to help regulate your taste acuity and your taste buds. So I will talk a little bit more about that in our next hour, but it is very intriguing also to see what happens in addition to everything I've just shared with you. When you dry the oral cavity, you also can start seeing pigmentation that starts to develop also in the tongue, in the gingival tissues, in the upper aerodigestive tracts that are very worrisome to patients when you first see it. And you really are concerned about, what is this? What's happening to my tongue? I see this blackish, this brownish, this reddish discoloration that's happening on my tongue. Could this be melanoma? Could this be a nuance of a thyroid disease moving to my tongue? And this is an impact that we've contributed to and that we've reported on for several years about pigmentation. We call it hyperpigmentation that can actually occur in the gingival tissues, the soft tissues of the mouth. So I'm going to ask Dr. Aponte. We're going to talk a little bit about management, and we have a marked number of ways to increase salivary function. We do it in a stepwise fashion for all patients who actually come to see us. We do a triage, we do a workup, and we start very simple, and then we move to something that is more pharmacotherapeutics. And we have studied and spent a great deal of time, energy, and government resources to work towards pharmacotherapeutics. Where we have put most of our time these days is in stem cell research and also acupuncture. Acupuncture is here to stay for salivary function, and it has been studied to such a degree that we can now say with great scientific evidence of proof that acupuncture can help you have better swallow and also better salivary function. And it really works. And so after about 15 years of some very large studies between our collaboration between us and China, we have very boldly said that it works, and it particularly works for lower grade mucosal challenges and salivary function challenges. We use a technique that we call the 13 points of Nipchow, and we have written about it. And over the last 2 years, we probably have had 6 publications that are specific to that. The cancer.net that I just shared with you, those are all links that you can actually get from that particular group. So I was going to ask Dr. Aponte just to generally speak to, yep, you bet. Yeah, please do. So sorry. Right there, perfect. Yeah, these are we've put this in several, you bet, several magazines on some short articles that we have promoted about ways to actually increase moisture. And this is some tips for that. Oral care is so important to our team. Every patient that comes through our group in oral oncology, we are 7 strong in our faculty. We have about 40 members that's on my staff in our practice. We're one of the largest practices in the United States. And we think very strongly about customizing oral care regimens for our patients. So Dr. Aponte, you may want just to go, and I'll kind of briefly go through just a few slides that kind of introduce about oral care and how we go about with decontamination.
Yes, so good afternoon. Thank you for having me. So we would basically start our patients with an extensive evaluation to see what the mouth is looking like. And within that evaluation, we want to make sure that, the patient doesn't have acute dental needs, such as elimination of these infection nituses, like the very first picture Dr. Chambers was showing of the patient that had a very large black cavity. So that would be one of the ones that we would say, we need to take care of this before you go into the treatment of the iodine radiation, right? And so some of the strategies that we use for these patients is, consistent oral hygiene, right? Instead of brushing maybe once a day, we would like for them to brush maybe 3-4 times a day. Perhaps utilize a soft toothbrush and consistently, consistently do the exercise of a small circular movements, right? Because if the softer the brush is, the less is going to swoop away the debris. And so you have to be kind of consistent with that circular motion. Also, we advocate the use of either a brush-on fluoride or the fluoride in a tray kind of like what we have here. In addition, we want to decontaminate the mouth with chlorhexidine gluconate, and that is the one with the bottle with the green letters. And that will also help to reduce the bacteria load. So all this is in preparation for that mouth while you will be having the radioactive iodine. Of course, floss. That's very important. If you've never been a flosser, you may want to have like a good instruction on how to floss. So like that, you will not hurt your gums. But if you are a flosser, you need to continue doing that. Water flossers are great too, like the water pick. It's never a substitute for flossing, but it's better than not doing it at all. Yeah.
So in addition to that, we also will consider what we call sialagogues, which are artificial salivas that we will also use. So artificial salivas that we have researched, contributed towards, have been many. And we have worked with many companies in researching. And for us to endorse, it usually is something that we consider as outcome assessed products. So some of these are very good for the mouth, particularly when you have a dry mouth, but it is not profound dry mouth. So someone who has low-grade salivary dysfunction, the Oasis that's in the center here that you can purchase from Whole Foods markets, this and also Tom's of Maine, they both put out a product that is so excellent and so well balanced that we really care for it. And many of our patients will, by our recommendation, will put these in little spritz jars or little spritzers that they actually spray into their mouth. And what we have found is that actually misting the mouth instead of gargling with these products can actually enhance your function. This also increases minor salivary gland function. And we can never forget about the benefit of minor salivary glands that are also in thousands within our mouth. Anything to add there, Doctor?
Some of the products that help to kind of lubricate the mouth, the ones that have like oil base, they tend to stick a little more and they last a little longer. And those are really nice too. So, read the ingredients. And so those are always great. Our patients really like those. Yes.
The Cathosol is also a product that is calcium with phosphate. And these freeze-dried sachets called Saliva Max is also something that we have advocated for several years as well. Calcium and phosphate together are a fantastic stimulant. And it also is quite excellent with its power of wound healing. And together, those are very much equal to another product that, although I don't show it to you, is equally powerful out of Whole Foods again, which is Ace-Mannan. Ace-Mannan is the active ingredient in aloe vera. And it is also a very good product that so many of our patients actually use who have profound xerostomia, dry mouth. And you'll use it in a Tom's of Maine aloe vera water. And it is how it is advertised. And it's quite excellent. And so something as a very good stimulant, calcium and phosphate. There are a group of many of these in the hundreds in the United States that are lozenges and little applications you can place in various parts of the mouth that melt, stimulate, secrete, but they never last. They never last long. And it's very true that we do care for any of these products that are xylitol instead of something that is sugar-based. Can really be so helpful to help destroy several bacteria, particularly mutant streptococci and another one that's very dangerous for teeth called lactobacillus. And xylitol is a great treatment against both of those type of organisms, and usually can help to stimulate some wound healing for teeth. So take home message here is that there are a great number of products that are on the market, and some you may like, some you may not. We care for the xylitol containing products. We also like ones that have emulsions that are with oil based. Some of these are going to be Ace Mannin based, again, aloe vera products. Some of these are going to have natural ingredients that are going to be herbal supplementation that we will like as well, that we believe are important. I'll talk a little bit about that on the next session to tell you a little bit more, kind of speaking from the hip, so to speak, of what we think are good products to consider. I'm going to end on acupuncture. Acupuncture is here to stay, as I said earlier. And although it's something that, as many of us grew up thinking it was probably more hocus pocus and something that we may not ever see across the Western world, it is astounding to see many of us who have been doubting Thomases of this, that it does work. And so after our database, we probably have somewhere in the vicinity of about 7,500 patients all over the world who have contributed to our NIH and NCI studies over these past 15 years. And we've published so much of the data from these. It is absolutely so amazing to see what this actually will do. And here in the midst of what we've have perfected, in my opinion, is the prescription called the 13 points of Nipchow. And this is what you would give to your master acupuncturist to do for at least 6 weeks, twice weekly. And Nipchow came from a colonel in the United States Marine Corps. And this is Colonel Nipchow's claim to fame of what he has contributed to our great need in oral supportive care to help enhance patients who have no other way. They're against a wall with regards to dryness, teeth falling out, teeth breaking. This has really been a rejuvenator. So it's something that I wholeheartedly and very strongly support. And Dr. Nipchow, he is a colonel in the United States Marine Corps. He's also a physician. Silodenitis, I wanted to end. I know we have about 10 minutes left. I wanted to share about silodenitis and its challenge with almost like mump-like challenges. With the higher the millicurie that you have on 131, the more challenge that one can actually encounter with these very problematic inflamed tissue that can substantially impact the ducts of major salivary glands. And these are painful. This may have happened to you if you had had 131 treatment. And the higher you go past 150 on millicuries, the more that this can actually occur. It can happen on one gland, it can happen on all 6 glands. And so this is something that we will see. We will, of course, always want to make sure that we don't see necrosis in the ducts. So we will do scans many times, or we'll do what is called scintigraphy, so we can actually see the function of the soft tissue and making sure that we don't actually see disease. And peritonitis and silodenitis, it has for many, many years, probably for over 60 years, talking about silodenitis. In many textbooks, we'll talk about massage therapy. We have found that TENS units and also having the ability to use lymphedema therapy through speech pathology services in the United States has been very beneficial. Today, we use compression stockings that are actually made for the face in order to help when a patient tells us that they're getting some swelling, pain in the parotid glands nearest your ears or under your jaws. We will customize lymphedema garments that actually can help, particularly at bed rest, and can help with regards to moving fluids through constricted ducts that 131 is so well known in doing. And eventually this regresses and eventually this gets better. But along the way, you can destroy some tissue when you cause this type of congestion, and then you can get infection in these glands as well. Sialodonoscopy. Did you have another comment, Doctor?
Yes,
Yes,
and
please.
it's super important to tag along this because if the mouth is clean, more likely, right, you will not have like an extra or super infection of the glands, right? But if the mouth is filthy, more likely you can have, the idonitis, along with infection. And so that's why also it's super important to keep the mouth, super clean. So, yeah.
Indeed so. Well said indeed. Our partners in head and neck, we have for the last 10 years launched our sialodonoscopies procedures where we actually introduce little cannulas that go into the ducts that are where saliva exits. And so because 131 therapy particularly is known to scar the ducts that secrete saliva, we have been doing these sialodonoscopy procedures that introduce these very small little catheters that under general anesthesia we will introduce into, whether it's under your chin or the glands that are closest to your ears called the parotid glands, and we will create a dilatation. We dilate the ducts in order to have better flow. And many times all of that swelling comes from congestion and that the ducts get very compressed. So we have a dilation type of system. This is an example of that. And I do have a video here, and I doubt it's going to play with all the other hardships we had to start this presentation. So I'm not going to kill this presentation other than to say that we will usually use 3 of these dilators. These are extremely small. We're doing, again, this under general anesthesia. This is a very incredibly important procedure for so many patients. After we complete that dilatation, we clean out any debris or infection, and then we place a stent that will eventually be removed, but it keeps the end of the duct in a position that will program the duct to be open and better with patency for secretions. It's really amazing. Dr. Stephen Lai in our head and neck surgery service has really led the way in the United States on our sialodonoscopy. And we have studied not only its impact, but also long-term benefit. And we've published that as well. So the future is increasing our acupuncture, and also now introducing with many of our partners in Europe, our research, taking it from preclinical research to now clinical research on stem cells, and taking mesenchymal cells from fat principally, and being able to reprogram those cells to stimulate salivary function and regrow salivary function, particularly those glands that have had external beam radiation damage. So we've contributed on the ThyCa website how we see 131 on care of the oral cavity and the upper aerodigestive tract. Particularly our MD Anderson websites, we have very easy and patient-friendly downloadable patient tools, and many of our research that you may find to be of interest to speak on oral care and guidance. There are so many education tools, patient education tools, that we also advocate. And so that's where I'm going to end. And Dr. Aponte, do you have anything else that you wanted to end on? Any other note that you wanted to speak on?
No, just I think we cannot stress enough the importance of the oral care, and the strategies that you can, implement to help your mouth, throughout this time. One of the things that maybe Dr. Chambers didn't capitalize on was the alkalinization of the mouth. And that is very simple and it's very easy to do with sodium bicarbonate mixes with water. And so that, you know, throughout the day, if you can rinse your mouth with a solution made with sodium bicarbonate, you can alkalinize the mouth, make sure that, you know, the pH is not so acidic. And then in that way, it also, you know, helps to keep, you know, everything more balanced in the mouth. So the dilution that we like is 1 teaspoon of baking soda to 20 ounces of water. And then every 2-3 hours, if you do a little rinse and then swish and spit out, that really helps too. So very simple and very, very inexpensive too. Yeah.
So we're going to end just by saying that we're very grateful to be part of the ThyCa group. We are introducing, because of the limited time that we are simply introducing some concepts and some ideas that we would hope to whet your appetite. There is a lot of products that are on the side of antioxidants, and also some products that you may be surprised that we really enjoy and use it within our practice. And again, you can see much of that on our website at MD Anderson. And our website is here. This is the website at the bottom, the www.mdanderson.org. And these are our private email addresses too. And we are so eager to share with you the data that we have and ideas to enhance your oral health. And we certainly will provide that to you if you reach out and ask about whatever it may be that you may not feel comfortable presenting to us today, but you have something that's happening to your mouth and you want to have one-on-one. We're so eager to do that, and we will answer you. Our staff will help to answer that question you may have. I have a very good sermon on Manuka honey and what it can do for oral wounds. And we really like Manuka honey. And so I can tell you a little bit more about that maybe in the next hour. Questions? I'd love to, I think we have a few minutes, and any comments, please.
When you're undergoing or sour
Isn't that the way most medicine happens? Right. Yeah, we go back and forth also about it because there is very weak data to whether you stimulate the gland or whether you don't. And there is also very strong research that if you stop the gland completely, like with atropine, you may have a better chance of having no destruction of the gland if during 3 to 4 days after 131 that you completely stop saliva. That's tough business also. It's really tough business. So that is where I introduced to you the tonicity of tea. I really like herbal teas. And at Anderson, we have really gone away from using stimulants like candies and other salivary candy type of stimulants. And we have found that the chamomile tea and the black teas are quite excellent as stimulants, but very mild stimulants that don't overproduce. I think it has to be kind of in the middle of the road. I don't think you want to overproduce, but I do think you want to stimulate. And you want to stay away from very high concentrated sugar. And you want to stay away from salt also during that time. So two things that can not only probably enhance all of our diets to some degree, but it can be very beneficial for those first 3 days after 131 is introduced. It's a fabulous question, by the way. And in my 30 years, I have to tell you, there's no gold standard. Yeah. Please.
During the daytime, I'm okay. I just got 15 seconds. My popsicle, there was some stuff gel that they recommend that I use during the daytime to avoid the mouth being dry. And that was pretty normal during the daytime. But when I go to sleep and through the night, I can feel my mouth going dry. What would you recommend?
Dr. Aponte?
So the Xylamelts that Dr. Chambers had the picture there, a lot of our patients, before they go to bed, they put one here and one here. And then they go to bed and then they feel like they don't wake up as parched. So those, tend to moisturize in a very nice way. And of course, you can do a humidifier as well. Put a little humidifier in your room, and that also helps. So that's what I would tell you. Yeah.
Yeah, I hear that and I say, oh my gosh, you would do so excellent with acupuncture. You're the person we want to see come through our door, because acupuncture, even if you did 3, possibly 4 weeks of 2 sessions per week, you are going to see a change in your life. I know that I feel so strongly like a bad salesman on this topic, but I feel so passionate about it because I see it across the world who use it. I see it in the Middle East in our studies with our partners there. I see it certainly in China, and I see it strongly at our institution. Yeah, think about that, please.
On the topic of the acupuncture, for somebody who has been, 5 to 10 years out from treatment and they failed colonoscopy, would acupuncture still be something that might work?
Yeah, I certainly would try it because I would want to go with an accredited acupuncturist and one that is accredited. I would say to you that you would benefit from having acupuncture with a little electromagnetic stimulation to stimulate your salivary function. And that's another way of stimulating through acupuncture. And the other thing I was going to share with you also was hyperbaric treatment. Hyperbaric oxygen treatment can also, we use it when there's bone necrosis. It's been something I've used for all my practice, in my surgical practice. And I want to share with you, hyperbaric may be a very good option for you too for stimulants. I would never go high on the number of sessions that I would do with hyperbaric for you, but I would probably do something around 10 to 15 sessions using either a monoplace chamber or a multiplace chamber. And that usually is in a wound care center. And you would do a 90-minute treatment 5 days a week. And I would do at least 15 treatments for 3 weeks. And that's something that if you go to the right center, that is going to be easily defended with regards to medical insurance and to defend that the cause of your dryness and what needs to take place.
If you can go anywhere, what would be, if it's not dental insurance,
Right.
if it's medical insurance,
Right.
that I could go anywhere,
Right.
where would you suggest?
Well, of course, we live in the South. Of course, we're gonna promote us. There is not MD Anderson, but actually Herman Hospital in the southern United States, in Houston. It's the father of modern day hyperbaric oxygen treatment. His last name was Fife, F-I-F-E. He was at Herman Medical Center. And Herman has one of the largest hyperbaric facilities in the United States. And so you see a lot of people going there for a variety of reasons. And that would be one service. The other would be at Memorial Sloan Kettering and out of our partners in New York. They have a fabulous system too that is a conjunction with Cornell. And that would be another very strong group for you to consider. you drop me an email and I'll send you a whole bunch of information about that. Right. That's a great question. Hyperbaric. Please.
So you said that to find a good acupuncturist, how are they accredited? Like,
You know,
I know there's many around, or how do we find out?
right, exactly. There are several accrediting organizations. And the one that we prefer is the American Board of Medical Specialties. And that is an accrediting group that is overseeing most of the acupuncturists that are related to have a medical connection, let's say. And many are physicians that actually lead those efforts. So instead of going to kind of a corner acupuncturist that's next to a fast food restaurant type of thing, I hate they narrow it down, but I do see a considerable number of those in the South that there's a Chinese restaurant and then there's an acupuncturist that's in there as well. They're not accredited.
Right.
Most of them are not, and I probably get a lot of hate mail from saying that, but it is absolutely so essential that you have an accredited individual actually delivering it, because it's going to be delivered accurately, and they're also going to give you a bill of safety. It's all about safety, isn't it?
Mm-hmm.
Yeah. Great question. I can send you some information too. Send me an email. Do you have anything to add to that?
No, I agree. Yeah.
Please.
Your email is kind of hard to read.
Oh, yeah, it sure is.
Yes,
Wow, look at
please.
that.
Cut that out like that.
Cuts it right off, doesn't it?
You can
Wow.
X out of that.
Don't X out.
Yeah, because I found that option. Oh, is it?
Is it a pop up right here?
No, it might be on this.
She can bring you can bring the toolbar down.
No, it's gonna be on the computer.
It's M Chamber. My last name was
Oh,
actually
Chamber,
Chambers,
no
but they didn't have, I had too many letters. So it's M Chamber at mdanderson.org. M Chamber. Please, anyone else? Appreciate that advertisement.
And just, we need the mic so that.
No, thank you very much too. I want to thank all of you for attending. I know you never necessarily know what the topic is, how it's going to blend, and what you're actually going to hear. We wanted to come in with a very common sense discussion about products and a little bit about just our conviction about what happens in the oral cavity and what we believe so strongly can enhance your health, oral health and general health indeed. I want to thank you. MD Anderson thanks you also for putting us at the podium, and we hope that you have a great meeting. Thank you so much.